Very good evening to everyone. I'll be presenting our 5-year data of simultaneous Ozurdex with cataract surgery. So we all know that cataract surgery is an inflammatory state, and if a pro-inflammatory state is coexistent, like diabetic macular edema, there is a force multiplier effect. We are aware that Ozurdex provides a steady dose of steroid in the vitreous cavity, but it all boils down to our approach, that whether we want to have a preemptive approach of giving an intravitreal anti-VEGF or a steroid with the cataract surgery, or a wait and watch approach where we react when the CME occurs. So out of all the indications which are there for simultaneous cataract and Ozurdex, we focused on pre-existing DME cases, and we knew that DME as well as the cystoid macular edema post-cataract surgery respond to Ozurdex. The key issue was timing the Ozurdex and to understand whether it is safe and efficacious. So we wanted to test our preemptive approach. The confidence for doing this study came from our previous use in pars plana vitrectomy in a simultaneous approach in cases of retinal vasculitis, epiretinal membrane retinal vascular occlusions, which had shown that even post vitrectomy, when Ozurdex is given, it gives a long-term anti-inflammatory action. So why not in cases of cataract? So this is our method of injection. Many people, apologies for the video. Many people ask us that how you are able to give it simultaneously, and what we do is that we are able to manage the AC with the AC maintainer or the irrigation port and give the injection simultaneously. Yeah, now the video plays, but we cannot see the injection. So we had 1672 such patients, 836 out of which had undergone a simultaneous surgery, and in these patients we had a minimum 12-month hospital registry data available of monthly follow-ups, and we took 836 control eyes from our patient data and we checked the efficacy and safety parameters. This was our methodology. And coming to the results, the best corrected visual acuity, when we compared both the groups from 0 to 52 weeks, did not differ much. But if you look at the 6-week data, that is the time when the patient expects the best results of the cataract surgery to come, there is a huge difference between the simultaneous versus the reactive group. Same was the case with central macular thickness, where we observed a significant fall in central macular thickness in the combined group compared to the reactive group. The number of re-injections which were required, and mind you, all these re-injections were only ranibizumab. None of the patients were treated with Ozurdex or any other anti-VEGF in the 52-week follow-up. So the Ozurdex group, where a combined injection was given, required much lesser number of re-injections at about 548 in 52 weeks compared to 908 injections in sequential cases. Also, there was a change in the need for topical NSAIDs. So patients who had undergone only cataract surgery, who had a pre-existing history of diabetic macular edema, by 4th or 8th week were already started on topical NSAIDs, and as you can see on the graph, the requirement of topical NSAIDs was much more. When we talk about IOP changes right after the cataract surgery, we realize that there is definitely a 2 to 3 millimeter mercury rise in IOP in combined group. However, it can be very well controlled with administration of IOP lowering drugs. There was also a comparison of floaters. Ozurdex as a floater post cataract surgery is talked about a lot, but as we can see with this chart, that over 6 to 8 weeks, we realized that the number of floaters even in a simultaneous cataract surgery group start increasing, and by 52 weeks they equalize. We also talked about the adverse events related to simultaneous injection, where in 4 such cases we had to suture the entry site. In all these cases we were doing a fluorescein staining at the injection site to see if there was a leak. In 2 patients there was a post-operative leak. In 1 case of simultaneous injection, we had an endophthalmitis. Mind you, that was not with the Ozurdex, and there were much more subconjunctival hemorrhages occupying more than 3 clock hour in the reactive subgroup. So we like to conclude that Ozurdex is safe along with cataract surgery, and it gives an additional advantage of long-term CME prevention and best corrected visual acuity gains. Thank you.
Yeah. So did you find certain side effect you have already shown in the graph?
Ma'am.
So, and the site of injection was 3.5 millimeter from limbus after your, Ozurdex. Where did you inject, like, site?
Okay, ma'am, the site of injection is always inferotemporal. So what I was trying to show in my video was that this was a left eye. With the left hand you stabilize the eye, with the right hand you go in the inferotemporal quadrant and you direct your implant inferiorly so that it settles down and does not settle over the macula. That was the aim.
Yes.
Okay, thank you so much, Shishir.